Doctor, we're here with Leslie. Leslie, thank you for allowing us to share your treatment. We're going to be doing some Sculptra. We're doing a little tightening through here in the upper eyelids. And Leslie is one of our A+ students looking for extra credit. I mean, you really look so good. And she wanted to do a refresh. She doesn't want to wait for advanced aging changes and just wants to refresh through here. And we'll put a little bit of volume back. She's very athletic, looks so good. And here are some of her before pictures. You're looking at the before. This is her right here. And so we take our little pictures here so that way we're going to try and draw this tissue back with the lift. We're going to refresh some of the eyelid skin doing the 1 stitch and then the Sculptra injection poly-L-lactic acid, and that's something that builds the body's own collagen. So Leslie, did you have a chance to go through our book?
Yes, I did.
Was that helpful?
Extremely.
Okay, good.
Yes.
All right, I'm glad that that was helpful. How did you hear about us originally?
The internet, searching, looking.
Okay, very good. Yes, we're out there and we're putting teaching out there now. A lot of people are unaware of what their options are, so we really enjoy putting the videos out so people can see what's possible. So I like to use the Avogard cleanse, and Ari has everything, Ari and Nina have everything set up perfectly for us. Makes it very easy. And then I always show the patient, we've done the little white pencil marks. Can you zoom in just a little bit? Sorry. Yeah. Great. And so I always like to confirm, have a look, as we talked with the white pencil marks that we're focusing right in through here on the cheek, the temple, and around the mouth. And if patient has anything else that they want to talk about, they can let me know now. So those are the areas we're going to address. So Leslie, can we share with them how young you are?
63.
63. Now this is not the picture of a 63-year-old woman. She looks amazing. People can mistake you for being in your 40s, depending on your behavior, of course, depending on if we act immature or not. But
That's usually 12.
that's good. That's good. And very good. So now, once I've done the cleanse, that's the HIBA cleanse, and then a little bit of the alcohol swab to clean the skin. And then I'm going to do some of the numbing medicine. So you have those are zoomed in pretty well. See if they'll zoom in
A little bit more?
close. Yeah,
Sure.
just a little bit. So I like to use the lidocaine as 2%. It's a little 30 gauge. It's super, super tiny. And you can see that there. Thank you for watching. Hello, Cheryl. Okay, so rest your head all the way back. And you'll feel a buzz. And then pinch here on 3. 1, 2, 3. Pinch. Feel big pinch, little pinch. Not too bad.
No, it's fine.
Okay, all right. Buzz and then pinch on 3. 1, 2, 3. Pinch.
Cheryl says 60 is the new 30.
That's true, especially for Leslie. 1, 2, 3, pinch. And for the physicians and students that are watching, 1, 2, 3, pinch. I think it's important, 1, 2, 3, pinch. As you're injecting, you're encouraging and you're coaching the patient because they want to do the treatment, and you always want to let them know things are looking really good, which they are. They're looking great. 1, 2, 3, pinch. And when you do the numbing and you ask them, did you feel a big pinch, little pinch, small, medium, big? And they'll tell you 1, 2, 3, pinch. The reason why I say that 1, 2, 3, pinch. Was that small, medium, big? Medium, small, medium. 1, 2, 3, pinch. It allows the patient an opportunity to admit to themselves or tell you, yeah, it's small, it's not a big deal. 1, 2, 3, pinch. If they're telling you they're having medium pinches, usually medium pinches are still tolerable, but if they're saying it's big, then you really need to either back off or try a different approach or numb a little more slowly. And so that's by design. You give them those choices, so very quickly they can feel in control of the treatment by using their own language and saying, yeah, it's a little pinch or middle, or even if they say, well, that one felt a little bigger, then you try and make the next one as little as possible, so that way they say they're building confidence and they're not feeling, oh my goodness, is this really gonna be uncomfortable? Do you feel a little bit of a pinch here? Not too bad?
Very little.
Very little. So then, and the more I do that, she doesn't feel that much. This is all building confidence where her brain is saying, okay, well, if you don't feel that much there, a little pinch here, then it's, you can tolerate it and handle it. Now Leslie's tough. She's 1, 2, 3, pinch. We try and make it easier than going to the dentist office or getting a tattoo.
Oh, much better.
Yeah. And so the Sculptra, you may need about 3 weeks to start seeing some results with the Sculptra, but even 2 months and up to 6 months, you can see continued improvement. Little pinch with the Sculptra. So it's a great option. 1, 2, 3, pinch. And we use a lot of it. I like to use the safety cannula. And for Sculptra, I like to use the 25 gauge 2-inch cannulas, and Ari's got things mixed up for me. So we start out, so I'll use a little bit of gauze. So you see the cannula here, and that soft tip, it's not sharp on the tip, okay? And then I'm gonna turn your head this way just a little bit. So once you find the little insertion point, and then I twist, 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 you'll feel a little pressure, a little pinch. Twist, twist, twist.
Where are you located?
We're in Tampa, in the Villages, Florida, and this is a little bit of numbing medicine plus the filler together. Everything's looking good. Thank you for watching and thank you for sharing. Definitely let your friends know if you're watching live surgery. Share with them, because if you tell them later you were watching
Can
live
I book
surgery,
an appointment?
yeah, you can give us a call, 813-463-9245, or go to our website, imagelift.com. Image lift, pressure pinch. You feel a little pinch there?
Not much at all.
Okay, very good. And it's much more comfortable. I used to do the Sculptra just with needles, but it was more uncomfortable and the bruising was just tremendous. So this is far superior with the cannula. There's no comparison on how much better the cannula is than the needles. Very good. So now I did 1 syringe through that side. We've diluted 1 full vial. And then when I'm changing to the next cannula, I like to cleanse the cannula. Changing to the next syringe, I cleanse the cannula with some alcohol. And then Ari has it all mixed up for me, because you want to frequently mix up the Sculptra. So for the physicians and students that are watching, I'll go back and forth from same like body parts. That way, it's, you know, it's, you take, as when I'm training people to do fillers, it's, you want to do the process that's going to give you the most consistency. Pressure pinch. So the moment, pressure pinch, I know how much and where I injected, and it's still fresh on your mind, then you do that straight away on the other side. You can inject the full one side of the face before you go back to the other, but I just like to do segment at a time. That way you're really being meticulous about how you distribute the product in a symmetrical fashion between both sides. That's the way I like to do it. Leslie, how are you feeling, dear?
Oh, fine.
So we were talking a little bit, so remind us, what was it that inspired you that you wanted to do a cosmetic treatment? Why did you want to do a treatment?
To be quite honest, just some of the lines I wasn't too happy with.
Uh-huh.
I look so much like my father. And he's in his 90s, and I can see how I'm going to age, if I'm so lucky. And just wanted to feel pretty.
Well,
That's all.
you are definitely very beautiful and pretty, and our job is to enhance and make the most of what we've got and prevent the future aging changes. So it's an honor to be a part of this with you. I'm going to turn your head this way. So we did some in the cheeks, 1 syringe in each, and now we're going to be doing the temple. If your dad is 90, then that's a good sign, and you're well on your way to a long life, taking great care of yourself. Pressure pinch, pressure pinch, pressure pinch. So once I advance, then I inject a little bit, and if you remember, that's what I call the hydrodissection. So now that I put a little bit of fluid there subcutaneously, as I massage the area, it presses the fluid out, makes it much easier for me to advance that cannula through the subcutaneous space. Thank you for watching and thank you for sharing. Make sure you're following, because we will be rebroadcasting later. She feels a little pinch there. I can sense when she raises a brow, I see it. So, how are you doing, Leslie?
Oh, fine, fine.
A little pressure pinch, pressure pinch. Pressure pinch, pressure pinch. And if physicians or students that are watching, you know, one of the things, of course, that we really love about what we do, we get to know our patients, and when we ask questions or talk to them about their lives, it's wonderful to learn about them, but it's also, when, you know, you're having a conversation, it's another way to just makes the time fly. Patient isn't thinking about the treatment, and even doing our videos, a lot of patients say, wow, that was really fun because I was listening and seeing you on the video and hearing the comments, and it's it takes the mind off of what we're doing, and it's very educational and entertaining. You used to have to go to the university to observe and learn from the academician and look over their shoulder, but now you can do it from your cell phone in your back pocket with your AT&T and Verizon plan. It's amazing what technology allows us today. Okay, so we did the temple. Now afterwards, we'll have Leslie do a 5-minute massage 5 times a day for 5 days. And from the lift, we're going to see her tomorrow and do the wound care. She'll have the wrap, and we'll show her all of that. And then I'll see, we'll do the 1-week follow-up, little pressure pinch, pressure pinch. Feel a little pinch there? A little bit. And so, a little bit of fluid here. Once I put this about 2/10 of a cc, then I'm going to do a little massage, and that is going to do some hydrodissection underneath in the subcutaneous plane, and then that opens up, makes it a little bit more easy to advance the cannula atraumatically. Very good. And with the Sculptra, people usually 2-3 months later, they may decide to do another vial, or they like it, you leave it alone. But even up to 6 months after the Sculptra, you can see continued improvement. Thank you for watching. Thank you for sharing. We're in Tampa and the Villages, Florida. You want to learn more, you can download our book on Amazon. We guarantee we can make you look younger, and the Smile Prescription. Pressure pinch. The cannula makes things so much safer. It's very difficult to get the filler into a blood vessel, cause scarring, loss of vision, damage to surrounding structures. That's why you want a cannula, safety cannula. That's why you want an expert injector. So now we've done the cheeks, we've done the temples, and we're going to do around the smile lines. Everything's looking good. How are you feeling, Leslie?
Wonderful.
Perfect. The best part of what we get to do is the patients we get to work with. Leslie's doing a great job. I'm going to turn your head this way. Make a big smile for me. Notice how the creases deepen when we smile. Now relax as best you can for me, please. So I find the little pore that we created here. Perfect. So I'll do a little bit in the smile line here. Some people say they don't want to smile because it makes more creases and wrinkles, but those are the best looking wrinkles you'll ever get when we're smiling. Pressure pinch, pressure pinch. So Leslie, where do you feel you get your smile from? Were your family big smilers, or sometimes we just go through tough times when we realize how good we have it? Where do you feel it comes from for you?
My parents.
Oh, that's nice.
Oh, they're in their 90s and late 90s, and they're the kids.
They're the kids now, huh?
Yes, they have so much fun.
Oh, well, good for them. That's the way to do it. I like it. I like them already. Are they exercising still?
Yes.
Oh, good for them. What kind of exercise do they do?
They go to the gym, they go walking.
Good for them. That's smart. That's the way to do it.
And then I have triathlons for my cousins, and she's in her 80s.
She's still doing triathlons in her 80s?
Oh, yes.
Oh my goodness, that's amazing.
She just came back from Mount Kilimanjaro.
Wow.
Just hiking.
I just met the president of and CEO of Ironman.
Wow.
He lives here in Tampa.
That's amazing.
It's got started here with Dr. Gill's in Tampa.
Mhm.
Let me turn your head this way just a little bit. Okay, so now I just find that little pore that we created. Perfect. And then I do my little twist, twist, twist. And thank you, Nina, for making the cameras work.
You're welcome. Sorry.
That was Nina's cue.
Trying
Just a little late, but she still got it.
to read what's going on.
And little comments and everything going on.
Someone
Thank
said
you.
good job.
Thank you. Thank you for the comments. Thank you for the shares. We're on YouTube, youtube.com/ImageLift, /image lift, and we're also on Instagram.com/image lift now, right now. If you're interested in pricing, you can go to imagelift.com/pricing, and then if you come out to our events, my staff was telling me we're so booked in the schedule that the easiest way to see us is just come to an event, because it's pretty booked. But we do an event almost every week, and go to imagelift.com/events, and that will that way you can see the schedule. Okay, just a little more, and then after we're done with the Sculptra, we'll lay Leslie back. And you feel that relaxing medicine settling in?
Still, yes.
Okay, good. So now that I've done one pass in that area, she'll probably feel very little over here, because that numbing medicine really does a great job to numb the area. Okay. Perfect. Turn your head this way a little bit, thank you. And as you'll notice, even when you're positioning the patient's head, just a few little fingertips in the right area, and you get the patient to guide themselves. It's important, I think, to position patients that way, because you want them to feel in control. They're moving their head. You don't want to move it for them too much, because you don't want them to feel like you're pushing them around, and those little details, they mean a lot. They'll tell the patient how attentive you are to their needs, and you always want to be tuned in to the patient's desire, to their goals and their preferences. Okay. All right, a little bit more, then we're done here. So thank you all for watching, and thank you for sharing. Make sure you're following on Facebook and Instagram for Image Lift. Now open your eyes. I want you to look straight ahead for me, and now rest your head all the way back for me, please. Perfect. Pressure pinch. Just a little touch more. Okay, and a little more over here. So with the Sculptra, you see instant results, but this is not the final product. As we say, you don't want to taste the chocolate cake before it's done baking. And once I'm done with the filler, and I'll show Leslie here. Why don't you open up your eyes for me? So can you see how it builds up the volume there?
Oh, yes.
How's that look so far?
Look, awake, refreshed. Yes, not tired at all.
Yeah, it looks good,
Yes.
and it's a little swollen now. If we just do the Sculptra alone, that goes away completely, then the collagen builds, so you get an idea. So we're all done with the Sculptra, and then you can see, we'll just show you one more time where we started. You're seeing Leslie right now. You're looking directly at her, and then here are her pictures from before. She looked amazing, so she just has a little bit more volume. Yeah, bring it all the way over here. So
Yes.
the before and the after, and then there'll be more to come, because we're going to do some tightening in the eyelid. So thank you all for watching, and more videos coming soon. We'll see you in the next video.
Great.
Bye-bye. That one, it's upper on that one. Got a lot of clicks to do.
There we go, and that one will start.
Oh, sorry.
And
Yeah, that's fine.